We're commemorating World AIDS Day, first and foremost. Every year on December 1st, we come together to reflect on the epidemic, the last several decades, and particularly those we've lost to the disease. But today are turning that into a hopeful day by launching with all of our partners the Bounce to Zero campaign, which is going to be a comprehensive communications campaign to get the word out to the public in Louisiana about HIV, about the many, many options and resources available for preventing, for testing, and for treating it.
All right, good morning, everyone. Thank you so much for attending our press conference today. My name is Vatsana, and I am the director for Ryan White Services and Resources Program, which is a division of the New Orleans Health Department. The city has been receiving Ryan White funds for over 20 years to provide access to HIV services and life-saving medications in the New Orleans metropolitan area. Also known as the New Orleans EMA, this includes services to Orleans, Jefferson, and 6 surrounding parishes. So thank you for joining us today in our launch of Bounce to Zero. Never before have we had the tools and resources to end the HIV epidemic, and I am happy to say that today, with the additional Ending the HIV Epidemic grants, it is now within our reach. We are encouraged by support from community members, stakeholders, and the entire metro area. With that, I'd like to share a video of Mayor Cantrell and Jefferson Parish President Cynthia Lee Shang.
Hi, New Orleans. It's me, your Mayor, Latoya Cantrell, and I'm so excited to kick off our Bounce to Zero campaign to end the HIV epidemic in New Orleans and our entire metro area. Our efforts can reduce our new HIV infections by 95% by 2030. I'm asking you to take this pledge with me. It starts on today with World AIDS Day. So with that, you can go to bouncetozero.com and you can easily fill out that pledge form, and I'm going to do that with you right now. So click on bouncetozero.com.
Hi, this is Parish President Cynthia Lee Shang. Today is World AIDS Day. It's a day to remember the 36 million people around the world who died from AIDS since this epidemic began. In Jefferson Parish, we have over 2,000 people who live with HIV, and that number is growing. In 2020, we had 54 new cases, and in 2021, we had 92 new cases. Together, we can raise awareness to end this epidemic. I encourage you to join me in supporting the Bounce to Zero campaign and sign the pledge.
In the New Orleans EMA, Orleans Parish alone represents 60% of the HIV cases. I'd like to introduce you to Dr. Jennifer Avegno, New Orleans Health Department Director, to talk about the Bounce to Zero campaign.
Thank you, Vatsana. Thanks, everybody, for being here. This is always a really, really special day, and we love hosting you here at City Hall, so thanks for joining us. You know, as you all know, every year on December 1st, we observe World AIDS Day, which to us is a perfect opportunity to remind and inform our communities about HIV and just bring greater overall awareness about testing and treatments. As Vatsana says, Orleans Parish does represent the largest burden of the about 8,500 individuals living with HIV in our region. So we know we have a lot of work to do. But finally, we can beat HIV because we have multiple tools now in our toolbox to do so. There's medications, there's early detection. We just need to increase the awareness. So we're really, really excited. Vatsana and her team have been working very, very, very hard on this campaign for a long time. And so we're excited to kick it off. And throughout the whole month of December, the Health Department, the Ryan White Program, and many of you and our partners are going to be promoting the new Bounce to Zero campaign. And so what we hope the campaign is going to teach the public is a few things. Number one, how to prevent new HIV transmission by using proven interventions, including things like condom use, regular screening, routine testing, the use of PrEP and PEP, and continuing the really successful U=U campaign. Also promoting awareness of how to get free HIV home testing. So now you'll be able to sign up for free on your phone discreetly by texting the word TEST to 504-290-0145. Don't worry, you're going to see that number other places. And you get a kit delivered to you in the safety and privacy of your own home, which is tremendous. And then just in general about the many, many services available for free that so many of you are a part of, whether it's testing, medications, assistance, health insurance, all the things that we can help those living with HIV to get in care and stay in care. And so because it's New Orleans, we also have some fun events planned for this month. Number one is the Stigma Summit, which is learning and fun on December 9th, and then the Bounce to Zero Ball on December 10th. You can find more information about this, sign up on our website at nola.gov/health and look for the Ryan White tab. And then you can get more information on all of this and all the events on the Bounce to Zero social media platforms. So I hope everyone will, like I did, take the pledge to end HIV today. Thank you all.
While the majority of cases of HIV cases has been in the metro area, in Orleans and Jefferson, 15% of the cases are in the rural area. Individuals living in the rural area often face greater challenges in accessing care, including stigma, transportation. And with that, I'd like to introduce you to Dr. Cantor, State Health Officer and Medical Director for the Louisiana Department of Health, to address HIV in the rural parishes and the state's commitment to ending the HIV epidemic.
Thanks so much, Vatsana. Thanks, Dr. Avegno. Vatsana, you and your team put together such a lovely series of events every year surrounding World AIDS Day. So thank you for hosting this, as you always do. Folks, thank you so much for being here. For people whose lives have been touched by HIV in one way or another, thank you for being here. And I particularly want to acknowledge all the public health workers who are here, Deanne, Sam, Jeannie, Anthony, everyone else who has kept their eye on this and worked towards this issue throughout the past few years while also responding to a 100-year pandemic. So thank you for doing that and sacrificing everything you have to do that. You know, we're in this stage with COVID, we're reflecting on what we learned and what to do different and what to take away from it. And I'll tell you, one of the things that I've taken away from the experience is an acknowledgement that we don't have to do the same thing the same way that we always have done. And we can look at problems with a new light, and COVID has really forced me to see that. For example, why do we accept 1,000 flu deaths every year? We can do more about that, and so forth. I think very the same way about HIV. There are 22,500 people living with HIV in the state of Louisiana today, and about 50% of them have clinically diagnosed AIDS. And Vatsana mentioned the tools we have now. That shouldn't happen. That's a solvable problem. We shouldn't accept that. That's an easily solvable problem. You also mentioned stigma, and that's something that we work every day to combat. I am heartened that I think it's getting better. I was heartened today to read the news that the FDA is finally starting the process to allow blood donations from people who are living with HIV. That's a fight that we've been fighting for about 25 years. So things can get better, particularly if we look at things in a new light and find new ways to approach it. So I want to commend everyone who works with or is touched by this issue in one way or another. I signed the pledge about 10 minutes ago. I encourage you all to, and I encourage you all to enact that pledge with significance and meaning. Thanks.
Jefferson Parish represents a quarter of the HIV cases in the New Orleans metro area. We are proud to have participation from Jefferson Parish in the Bounce to Zero campaign. Both parishes, including New Orleans and Jefferson, has 85% of the HIV cases in the metro area. I'd like to invite Ms. Sarah Babcock, Jefferson Parish Chief Administrative Assistant, to the podium to address on how Jefferson Parish will assist us in ending the HIV epidemic.
Thank you so much for having me here today. Many times when people hear about HIV, they think this is a disease, a virus from the 80s, from the 90s. They think this is for gay men to worry about. They think people who have sex for money need to worry about HIV, but not them. Maybe it's a racial group that it's a problem for, or maybe it's an urban problem, but that is not the case. This impacts many people across many different demographics. Jefferson Parish residents account for 1/3 of the new HIV cases each year in the metropolitan area. And I'm proud here to stand with New Orleans and with the state because we need to bring more awareness across our entire region to address the HIV epidemic, both in ending new cases, but also making sure that everyone who is diagnosed with HIV has access to adequate treatment for that. So I look forward to working with the Bounce to Zero campaign to find new ways to improve testing and care within Jefferson Parish. Just like Dr. Avegno and Dr. Cancer, I too signed the pledge this morning, and I really want you all to know that it takes all of us, every member of our community, to end the epidemic. You have heard we have the tools, but we need to come together to raise the awareness and reduce the stigma so that people feel comfortable getting tested and accessing care if they need it. So I want you to consider getting tested yourself, know your status, and make sure that you sign the pledge to end the HIV epidemic. Together, we can bounce to zero infections and zero people not receiving HIV care in our region. Thank you.
Thank you to Mayor Cantrell, Jefferson Parish President Cynthia Lee Shang, and to all of our speakers today. Thank you for also taking the pledge. And with that, we'd like to show you how easy it is to take the pledge. This is the new Bounce to Zero website. It says easy as scrolling down, and there's a button where you can click to take the pledge. And the pledge includes something as easy as just talking about HIV. We have to normalize HIV so that everyone gets tested, know their status, and get in care. There's no reason why we have people out of care. We have resources to help link individuals to care, free medications, assistance with health insurance. We know how that could be, and also rental assistance. So please, take the pledge, visit thebouncetozero.com, and learn more about other resources.
This is a complete statewide effort. We want everybody in Louisiana to take the pledge. We're so excited to have the Louisiana Department of Health and other state partners who really have been tremendous forces in this work to help us promote this.
Every year, Louisiana ranks amongst the top 10 of states, depending on how you slice it or what year it is, and this year is no different from that. The bulk of the cases around the New Orleans area, with Baton Rouge behind that. That's nothing new here. I am encouraged. I think we're making progress, and as was mentioned at this press conference, we have more tools now than we ever have. It's really an issue of connecting it to people. So there's 22,500 people in Louisiana living with HIV right now, and what depresses me the most is about half of them have AIDS. Now that's a treatable issue in today's day and age. With the medicines that we have, the HIV medicines we have, nobody who's HIV positive should have clinical AIDS. And with the funding mechanisms and the programs that are available, there are good support networks to help people into treatment, through treatment, provide housing if they need it. It's just an issue of identifying people, supporting them through that, and I think most importantly, reducing stigma, because that is a barrier to people getting treatment. That's what I'm focused on in the year ahead.
HIV and AIDS is a virus that has been an epidemic in the U.S. for 40 years or more now. So this has been with us for a long time, and I think it's sort of faded into the background as we've had other epidemics. It used to be a death sentence. It used to be if you got HIV, there was very little we as physicians could do to prevent you from progressing to AIDS, which is the more severe form of the disease, and many, many lives were lost. We are in a much different place now with proper medications and access to care. Living with HIV is just like living with any other chronic disease like hypertension and diabetes. But I think there's a real gap, and the public might not understand that. Some people think it's still a death sentence and are afraid to know their status, afraid to do what they need to do to protect themselves. But that's not the case at all. There's so many resources available, and people are living long, healthy, fulfilling lives now.
It's important in every metropolitan area. The bulk of the cases are in the New Orleans general area and the Baton Rouge area, with pockets throughout the state as well.
The best way to prevent HIV is to know your status, is to get regular testing and to talk about your status with your partners, with your friends, and just to be aware and communicating. By that, we destigmatize HIV, and when we destigmatize it, it's much easier for folks to have frank and honest conversations. I'm the parent of several teenagers, so it's really important to me that they know how to talk about HIV, they know how to prevent it, whether it's condoms, whether it's getting screened or tested regularly, and that they're talking about it with their friends.
I think it couldn't be greater. I have been living with HIV for 37 years, and in those 37 years I have seen a myriad of changes. People are living longer. I just celebrated my 70th birthday. I've been living with HIV for 37 years, and I can honestly say I'm living proof there's life after an HIV diagnosis.
What is your message to people around New Orleans and throughout Louisiana?
Know your status, definitely. Talk, communicate with your partners, friends, and family, and everyone needs to know. The stigma that has been associated with this disease has cost many people their lives, but I'm grateful and happy to say now that people are very much more outspoken and very public with their diagnosis and what they have to do to live with this disease, and there's a life after a diagnosis.
I think this pledge is great. You know, every so often you have to kind of hit the reset button and jumpstart everyone, and that's, I think, a good motivating factor behind this pledge. There's been initiatives in the past, there's ongoing ones. It's always good to kind of take a fresh look at things and get some new energy behind it.
And your official title is?
State Health Officer of Louisiana Department of Health.
Oh, I think this is a wonderful project. I think this is something that our team has been working on for a very, very long time, and it's so critical. We don't want there to be anybody in the New Orleans region or in Louisiana who doesn't know the truth and the facts about HIV and how they can keep themselves safe.
How can people get more information?
So they can go to any of the social media platforms, any of the Bounce to Zero social media platforms. They can check out the New Orleans Health Department website at nola.gov/health. Under the Ryan White Program tab, we have many, many resources. And certainly the Louisiana Department of Health has many other resources as well.